Council to order. We have a special guest tonight to say the Pledge of Allegiance. I've got scouts from Troop 151, I believe. So y'all come on up, please, and everybody stand.
Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please join me in the Texas Pledge. Pledge the Texas flag. I pledge allegiance to Texas, one state, under God, indivisible. Sorry. Not the strongest on the Texas.
Thank you, gentlemen. Well done. Item number 2 is the invocation. Do we have anyone from Kingdom Chapel here? We heard from them, seen them? Okay. Do I have a volunteer on council who wants to do the blessing? Anybody? I will. Thank you, sir. Thank you, Mr. Lawson. All right, item 3 is audience participation. So any item on the agenda you're willing to speak, you're allowed to speak. Please see the city secretary to sign up. Also, if it is a public hearing, it is open to speak. You don't have to sign up. So once I call for speakers at a public hearing, you're welcome to approach and speak. All right, item number 4 is the consent agenda. A is action regarding minutes of March 15th. B is action regarding execution of advanced funding with Texas Department of Transportation. C is action regarding geotechnical service agreement with CMJ Engineering. D is action regarding retail retention, recruitment, and development services proposal with Retail Coach. E is action regarding approval of ordinance 2022-04, amending the recreation community service fees. F, action regarding joint election agreement with Tarrant County for election services for May 7th. G is action regarding authorization of parks donation funds for 2022 4th of July celebration. H is action regarding disposal of city surplus items and agreement with Tommy Lutz Auctioneering. Any questions, comments? Otherwise, I'll entertain a motion. Mary?
Mayor, I make a motion that we accept the consent agenda as presented.
Do I have a second? Mr. Tucker, second. All those in favor, raise your right hand. All those opposed? Excellent. Thank you all. Let the record reflect we do have a quorum, a full house this evening. I appreciate y'all coming out. Item number 5 is proclamation for Child Abuse Prevention Month. So I believe we have a representative here, Lindsay Price from the, okay. First, I'll read the proclamation, then I'll present it to you. All right, so let me read this proclamation. Whereas children are the future and our greatest resource, whereas every child deserves a nurturing family and safe environment to grow into a healthy, productive member of the community, and whereas child abuse is one of our nation's most serious public health problems and threatens the safety of our community, and whereas Tarrant County, 6,511 children were confirmed as victims of child abuse or neglect in 2021, and whereas the Alliance for Children provides trauma-informed services to 2,497 children in 2021, whereas finding solutions to prevent child abuse is a community responsibility and depends on the involvement of all citizens, and where effective child abuse prevention, investigation, and treatment programs succeed because of partnerships among public and private agencies, schools, religious organizations, medical services, and the business community. Therefore, be it resolved that I, Todd Filippo, Mayor of the City of Saginaw, and the City Council do hereby proclaim the month of April 2022 as Child Abuse Prevention Month in the City of Saginaw, and urge all citizens to work together to help reduce child abuse and neglect significantly in the years to come. Therefore, I do affix this to my signature, April 5th, 2022. You want to say something before I present this to you, ma'am?
Thank you so much, Mayor Filippo, and to all of our community members, our city council members. My name is Lindsay Price. I'm the Team Relations Supervisor with Alliance for Children. I've worked in this field 13 years now. Crippen is walking out. I've actually worked many investigations with him calling me at 7 o'clock in the morning, asking for case information. I also live in this community. My children attend Eagle Mountain Saginaw ISD. So I personally feel so much safer employee. Their dedication is unmeasurable. They are so loyal and committed to our cause. They're amazing partners. I can't say enough about Corey Burnett and Crippen and all of our partners.
Did Crippen hear all that? He was outside. Did you hear that, sir? Okay. I don't want you to miss out.
We really do thank you. We appreciate this community and how involved you all are with our children, and we're just so blessed to have Saginaw as official partners. Thank you so much for this proclamation. It means a lot.
Item number 6 is EMS Week proclamation and MedStar update. For that, Fire Chief Doug Spears.
Thank you, Mayor and Council. Coming out of 2 consecutive, very challenging years for emergency medical services across the country and around the world, probably more pertinent now than any time in our history to recognize National EMS Week, which is coming up in May. This will be the 47th year. Before we get to the official proclamation, we have some senior leadership from MedStar to provide us an update about all things MedStar and our collaborative partnership. This is intended to be an annual event, but we've had 2 years of COVID that's prevented that, so we will catch up tonight, and after that, we'll move to the proclamation. We have the Chief Executive Officer, Ken Simpson, here, and the Chief Transformation Officer, Matt Zavodsky, with us. So we'll invite Ken to come up.
Good morning, Mayor, or afternoon, evening. Sure. Thank you, Chief Spears. My name is Ken Simpson. I'm the Chief Executive Officer for MedStar. You all have a hard copy of the update in front of you. I have committed to do this quickly. I apologize. It's a little longer than normal. It's been about 3 years since we've been here, so Matt tells me I have to talk a little less southern and a little more northern, so I'll try to speed it up.
Real quick, the button's not working. Just kind of raise your arm up.
All right. Okay. Button. There we go. So first of all, we'd like to thank Chief Spears. He's one of our authority board members. He sits on the First Responder Advisory Board as well, and the EMS System Performance Task Force. And that task force is tasked with setting performance standards within the EMS system. Some of you all are new. Just a little background on MedStar. We are an EMS authority, which means you all are part owners in the ambulance service. A lot of people don't necessarily realize that. It's relatively unique. So, that's part of the reason we come spend time and give you guys a little bit of update on it. Our graph here shows our staffed unit hours per day. Essentially what a unit hour is it's a measure of the number of ambulances that we have on the street during any hour there. You can see from 2020, when we had a drop in those unit hours up to 2021, it was about an 18% increase in unit hours. We'll talk a little bit about what drove that here. A little bit later, it has to do some with the work that the EMS System Performance Committee did. And during COVID, especially when COVID first came out, everybody thought our call volume would go up significantly. It actually dropped there in March by about 20%. So we were able to scale down some of the unit hours a little bit to save on some expenses and things like that. So, and then like everybody else, we got impacted because like the majority of our workforce contracted COVID. So, but our system performance, our response and transport volume is the next slide. You'll see again a significant increase from 19 to 20. As I mentioned in March, we had a drop and then it kind of started climbing back. It's more than a 10% increase from one year to the next. Seemingly the only thing going up faster than that is our inflation rate these days. So one of the things that we do to help provide a little bit of feedback from independent third parties is service performance evaluations, and it's done by EMS survey team. So what that looks like is an entirely separate organization reaches out to the patients that we've transported and looks for feedback on everything from how the dispatchers handled them, how they feel that their care was, how their response times were, even how the billing process went. And our patient satisfaction scores are pretty significant there. You see 91.01 kind of leads the country as far as that goes. So, which is pretty impressive given that it's normally about a $2,000 ambulance bill. So the fact that people are that happy is a good thing. During COVID-19, we instituted a few changes to try to help deal with some of the volume that we expected to see coming through. A lot of folks thought that, hey, I think I have COVID, or I have a family member that gets COVID, they need to go to the hospital. That wasn't necessarily always the case, and trying to keep the hospitals from getting overrun with non-acute medical patients. We would actually send our crews out to do some evaluations and take vital signs and things like that, give some follow-up directions as far as where they could get care at more appropriate facilities, and that way they weren't unnecessarily exposed or exposing others in the community. It freed up some of the hospital resources for more of the acute patients. And we even had protocols in place to be able to do that over the telephone with physicians if the call volume continued to increase. There's the next slide is kind of a picture of the in-home care instructions there. Again, with the follow-up scores on that, 98% of those surveyed rated it 5 out of 5. Because what we found through this is people really like not having to go to the hospital if they don't have to. So we found some different opportunities to be able to treat people in their homes and arrange for more appropriate care to be brought to them if they aren't necessarily that acutely ill. Some of the other COVID-19 activities we did on a daily basis, we had a line of cars out in front of the building there that we did COVID testing for Tarrant County Public Health and for some of the first responders. We also provided monoclonal antibody infusions for hospital overflow when they didn't have room to treat patients, some of the first responders that qualified. And we did mobile vaccine clinics to those cities that were interested in hosting those kind of things. We actually set up a trailer and had registration status and things like that for people to kind of walk through that. Oops. We don't have to go backwards. Our response times, or your next slide, we, obviously through COVID, we did some extra call screening to make sure that the first responders stayed safe. Your cardiac and respiratory arrests are really acute patients that weren't breathing, their heart wasn't beating, things like that. Obviously, we didn't delay any of the dispatch activities, but for those that were able to talk and didn't appear to be in any sort of acute issue, we spent a little bit extra time trying to determine whether they might have COVID so that our first responders didn't necessarily walk in to something that they didn't, they weren't expecting. It gave a little bit more opportunity to get the appropriate PPE on and take care of the patients. So the financial efficiency piece of it, it's part of our mission statement. Again, we use a third-party provider. We participate in a Medicaid matching program that requires us to do cost reporting. And for the last 7 years, we have been the lowest cost provider in the state of Texas. And we expend about $396.01 per transport on calls. That has gone up, as I mentioned about inflation rates lately. Our pay rates have also gone up for our employees, so I fully expect it to be a good bit higher next time around. But we pride ourselves on really trying to be as fiscally efficient as we can. The dual accreditation slide is another picture of using outside organizations to help provide some feedback as to the work we do. One is called CAS, and they basically come in and evaluate the ambulance service, the policies and procedures, the fact whether we have the policies and procedures in the handbook, and as well whether we actually follow those. So they go around and grab our employees and say, hey, what do you do in this case, and what does your manager do, and that kind of stuff, and make sure we're actually doing what we say we're doing. And then the International Academies of Emergency Dispatch, we're a secondary PSAP here in Tarrant County, and part of that requirement is that we go through and through a QA process on all our emergency medical dispatch calls to make sure that we're doing that appropriately and providing any feedback to the staff to make improvements and that sort of thing. And so between both of those, only 26 out of 17,000 providers are dual accredited. So we're rather proud of that. Some of our current challenges that we've experienced as of late are average insurance payments per transport have dropped significantly over the years. Medicare, as some of the programs have come out that have helped with the COVID relief and things like that, some of the fine print at the bottom of those is if Congress doesn't provide funding mechanisms for them, they actually cut our Medicare rates. So the American Rescue Plan Act and things like that, that's kind of the pay-fors for them down the road. Additionally, some of the commercial insurance has paid less and less over time, so we continue to work with the insurance companies for that kind of stuff. And in the same way with the average patient payment per transport, we've seen a corresponding decrease in that as commercial insurers pay less, balance billing ends up being a little bit more, and then people are less able to pay those co-pays and that kind of stuff. Our charity care write-off, the state of Texas recently started a charity care program where they take a look at the amount of dollars that we wrote off for charity care, and they use some magic math and provide some pennies on the dollar for that write-off. So we really went back and took a hard look at our charity care program because, as I mentioned, the average ambulance bill is about $2,000, and people are always concerned about, what happens with the people that can't pay that. We don't do hard collections, so we don't put liens on houses and things like that. It does affect their credit if they're able to pay and they can't, or they don't get back in touch with us. But one of the things that we did was we actually adjusted our charity care policy to start at 4 times the federal poverty level. So for a family of 4, that's over $100,000 a year. And basically, if they don't have insurance and they fall within that realm, and they tell us that's a big part. A lot of times people just don't call. But if they call and let us know where they fall, we'll write their bill off 100%.
Do you all offer like a payment plan for people?
Yes, sir. We offer pretty much any kind of payment plan that people want. We have, we've had folks pay as little as, I'm told, $10 a month before. So if they're willing to have the conversation with us, we're willing to try to work with them to make it happen. So. One of the, I mentioned a couple things that we did through the pandemic. One of the big ones is historically MedStar's always provided ALS ambulance service, which means a paramedic's been on the ambulance with an EMT. Believe it or not, some people will call for stubbed toes. When I was on an ambulance, I actually got a call at 7 o'clock in the morning, which happened to be a shift change for a gentleman that was going to take his girlfriend to the hospital, but he realized his car didn't have enough gas to make it there, and on the way back he sprained his ankle, so he called for both of them. So rather than sending a paramedic out to those lower acuity calls through the work of the System Performance Committee, we started a tiered response plan, which allows for 2 EMTs to be on an ambulance, and through that EMD process that I mentioned when the 911 call comes in earlier, there are certain EMD criteria where we can send these BLS ambulances out to. And basically the way that we got to that was we took a look at the previous 2 or 3 years worth of call data based on EMD code and said, hey, the vast majority of these patients, if not all of them, did not receive any ALS care, so why are we sending an ALS provider to take care of them? And by doing that, despite the national decrease in ambulances on the street, we were actually able to increase the number of ambulances we put on the street between 2020 and 2021. So, and the next slide's just kind of a picture of that. Some of the red highlighting there in the far right column is our potential calls that we may look at in the future. Basically, it's their low transport calls to be able to send EMTs out to evaluate those. ET3 is another big model. It's basically alternative treatment plans, and this has garnered national attention. Medicare started doing it about a year ago. We're one of the few pilot project or model. It's the federal government. You can't say pilot without jumping through a bunch of hoops. So we're one of the model organizations selected to institute this program in the country. And basically, again, with some of the lower acuity patients, we offer the opportunity for telemedicine with an ER physician in the home. So if they're clinically stable, we come out and we say, hey, I don't know that an ER is exactly the best place for you. Would you like to talk to a physician and have them kind of go through and evaluate your condition? Because a lot of times, a lot of people that call that they run out of their prescription medication. We had one lady call that just recently been discharged from the hospital, and she missed the fact that she was supposed to only drink clear fluids and not eat regular food. So her belly got upset again, and she called 911, and she said, no, I'd absolutely rather stay home. And so we gave her some fluid, something for nausea, and left her at home. We've gotten significantly positive feedback from that program as well. And so we're working to kind of branch it out and really find different ways to help people navigate the healthcare system and find the appropriate means to get into the healthcare system. We've been working with commercial payers to do this. Cigna, as of March 1st, we went in network with Cigna, and they've offered a similar program as part of our being in network with them. That's, as far as we know, that's the first of the kind in the country. And Medicaid is going to start a very similar program on September 1st, due in part to the activity and the phone calls that we've been able to make to the state legislatures to try to get them to support the program. So we're very excited about this because nationally, basically, we're seeing explosions of EMS call volume, and most organizations are not able to keep up with it, and it just burns providers out because you go to paramedic school to learn how to rip people from the jaws of death, save lives, and things like that. And when you get called out for a backache for 3 weeks repeatedly, it kind of burns people out. So just matching them up with more appropriate care is kind of how we see our model changing a little bit. That next slide has some just some data as far as the ET3 interventions. Nearly 500 patients were provided telehealth by MedStar crews, and 77% of that 500 was not reported or not transported to an emergency room. Everybody likes big shiny equipment, and so we got a new ambulance this year. During the I-35 accident, our old ambulance, we deployed to that to help treat patients and triage patients and also provide a warming shelter. This bus is provided in partnership with Iraq, and they basically signed the title over to us, and we agree to send it on deployments and things like that as we're able to staff it. It's the state of the art. The thing is huge, but it's very cool to go through, and we'll take it out on community events and show it to people and that kind of stuff. So we used it during some of the nursing home evacuations with COVID and things like that as well. So,
Can we get that to come out to maybe Train and Grain this year? That'd be cool.
That would be neat.
yeah,
Wouldn't that be cool? Let's put that on the list.
I bet you know a guy.
I bet you do. One of the best.
So we also did a little bit of new vehicle design. A little bit of a confession is there's like a microchip shortage or something about new cars. And so it was really hard to find vehicles. So we found this nice gray color on the pickup trucks. And we actually liked how it looked. So we changed our supervisor vehicles from white to gray with a little bit of different graphics this year. And that's one of the ambulances that we just recently remounted there as well. So mobile integrated healthcare is kind of our next topic. It's a little bit of what we've been talking about. We have a group that we affectionately call our HUG patients. They're a high utilizer group. In other words, those folks that call, how many times does it, Matt? More than 15 times a month? 15 times in 9 days. So sometimes they call more than once a day. And so, again, a lot of times these people, there's all kinds of reasons why they do that. And it's really having the intervention and trying to figure out why and helping them find appropriate means to get their needs met. And so we have folks enrolled in that group. We have readmission prevention programs for congestive heart failure patients, hospice partnerships. You can read them there really just to keep patients out of the hospital, make sure they're getting their care at home, because studies have shown that patients typically do better when they're cared for in the home because they're surrounded by family, and we can help facilitate follow-up appointments and things like that. So as you see in the box there are 156 Saginaw residents that are enrolled in our program. They're not all enrolled in the HUG program, but they are enrolled in one of our programs. We've been doing this since about 2009, and we're one of the few agencies in the country that have developed it well enough to be able to be standalone programs. Lights and sirens response is one of the things that we're evaluating in this upcoming year. There's a position statement that was signed on by 14 of the national agencies that really suggested we take a good hard look because, back in the 70s and 80s when we first started educating, 90s I guess, when we started educating people on calling 911, the calls that everybody was going on typically were emergency responses for chest pains, cardiac arrest, things that you think of when you call 911, so everything was a lights and sirens response. As technology has evolved and our knowledge has evolved, our ability to triage these calls has improved. Statistically, you're more likely to get motor vehicle accidents when you're running lights and sirens and not necessarily or running through red lights and things like that. So, why go to that risk if there's not going to be a corresponding increase in patient improvement? And so that's some of the activities that we're going to be working on in the upcoming year to figure out how that works in our system, and if there's a better way for us to deploy those sorts of things. Next slide just kind of has a picture of the agencies that signed on to that. And then the next slide, see, I'm picking it up. The next slide, again, has a few items highlighted from that position statement, just speaking to the safety of lights and sirens and really, treating that more like a medical intervention and using it only when it's really going to make a clinical difference in the outcome of the patient. One of the other things that we're taking a look at is the reprioritization goals. Historically, we have the way that the calls have been prioritized has been set basically by how the chief complaint looks. Much like I described with the BLS interventions, we've taken a 3-year look back, and our proposal is really to take that data that we have as far as how those patients ended up clinically presenting and what treatment they ended up getting and how they fared in the hospital, and utilizing that to rank patients. And the reason this is important is because if, sort of in the extreme cases, if you get dispatched and you're and you're driving by a cardiac arrest house where somebody's heart stopped, but you're on the way to a stub toe, our dispatch center wants to know that so they can reroute you to that cardiac arrest patient, and they'll send another ambulance to go to the stub toe that's from further away. And that's why those things are important, to really figure out, the right priority and the right ranking of those calls. It helps with patient safety and first responder safety also. And then the last call, or one of the last slides there, is just kind of a breakdown of our Alpha, Bravo, Charlie, Delta, and Echo being the most significant medical events that one could have when we kind of need to make sure that everybody's getting there as quickly as they can, from all the first responders to the ambulance as well. Shameless plug for our Star Saver membership. You just have to live or work in the MedStar area. $69 for a whole household with insurance, and basically what that does is we will file your insurance, accept payment for whatever the insurance pays for those medically necessary calls, and that's what we'll accept if you're a Star Saver member ahead of time. You can't do it afterwards. So there is an online enrollment process to try to make it a little bit easier for those that are interested. It gets you out of the balance billing and that kind of stuff. And one of the other things that we've developed this year, and we actually implemented it with an assisted living facility. The facility picked it up themselves. We're calling it a Star Saver Plus membership. It's $350 annually for the entire household, and basically what that gets you is the Star Saver membership. Plus, sometimes people just like the peace of mind of going, hey, I feel funny, or I kind of have this, I don't know if it's indigestion or chest pain, I want somebody to come check me out. And we'll send a critical care paramedic out to evaluate the patient and see what's going on and make recommendations and help provide follow-up care and things like that up to twice a year. So those are great benefits that we encourage people to take advantage of as well. And I am happy to take any questions.
Any questions for our friends from MedStar?
These hot operations, about how often, or what's the percentage or number of accidents you all have due to operations?
Well, so when we compiled the information, all of our employees that were injured in motor vehicle accidents were responding lights and sirens over the last couple of years.
Yeah.
What was it, 2 years worth of data and 8? 2 years worth of data, 8 of our employees, and those were just the ones with or with injuries to themselves.
Right.
Do you know off the top of your head the percentage of accidents responding hot?
About half of the crashes that we have are during hot operation.
Okay. Pretty significant. Appreciate it.
Any other questions?
Does that, the Star Saver Plus, is that, insurance included with that? I mean, do you have to have insurance for that program?
So you do not have to have insurance. If you don't have insurance, we don't write off the bill. That's a negotiated rate, if I remember right. I can't recall off the top of my head what it is. It is in the brochure.
It's $350 with or without insurance.
Okay, yeah, that's what, okay.
So
There you go.
that's the same for the $69 one. No.
All right.
But we can get your brochure.
Other questions, council?
How can we help you get the word out about these last two programs?
We're happy to provide links. You can put it on, if you're interested, you can put it on the city's webpage or Facebook page. Social media is great. One of the other big things is there are people that are eligible for the Affordable Care Act that aren't necessarily signed up for it. And that is also very hard to get retroactively. Not impossible. Star Saver is pretty much impossible, but there are links for that as well that we can share, because that obviously
We
helps
have
as well.
those on all our media outlets, and periodically we'll push those to the front, put a spotlight on it, and make sure it's seen. We'll move it to the top, so to speak, at times,
That might be something good to do during EMS week.
certainly.
So, thank you, both of you.
All right. Thank you, sir.
Excellent. Thank
Appreciate
you.
Chief, anything else you want to add?
No, sir. A couple of quick words.
Okay.
We continue to evolve our relationship with MedStar. We've got a great relationship with them. We continually evaluate our performance, both combined and separate, and continue to improve it everywhere. 911 seems to be the go-to for anything EMS related, not just emergency, so therefore there's our challenge. As you kind of heard, the government doesn't really want to fund that to the level it needs to be, so therefore that's the struggle. But we'll continue to provide the service that I think the citizens deserve. They do a good job. We do a good job in collaboration with each other. We'll move on to the proclamation.
The Mayor Pro Tem will read the proclamation.
Whereas emergency medical services is an essential public service, and whereas the members of the Saginaw Fire Department, MedStar, Saginaw Police Department provide life-saving care to those in need 24 hours a day, 7 days a week, and whereas access to quality emergency care dramatically improves the survival and recovery rate of those who experience sudden illness or injury, and whereas EMS agencies and personnel have expanded their roles by providing important preventative and follow-up care and access to telemedicine and are providing crucial services during the COVID-19 pandemic, and whereas EMS and other first response personnel are facing unprecedented challenges with response volumes and personal risks, and whereas it is appropriate to recognize the value and the accomplishments of medical emergency service providers by designating Emergency Medical Services Week, now, Todd, Mayor of the City of Saginaw, in recognition of this event, we hereby proclaim the week of May 15th through 21, 2022 as Emergency Medical Services Week with the theme EMS Rising to the Challenge, and we encourage the community to observe this week with appropriate programs, ceremonies, and activities. In witness whereof I do, he puts his hand and print on here. You're going to present it to him? Why?
All right, thanks, folks. Item number 7, presentation of Government Finance Officers Association Distinguished Budget Presentation Award to Jennifer Garrett. For that, Kim Quinn, Finance Director.
Thank you, Mayor and City Council. I'm happy to say that the city received the Government Finance Officers Association Budget Presentation Award for the 35th consecutive year. That's quite an accomplishment. I don't want you to think that because we've done it 35 years in a row that it's a slam dunk, because it really isn't. It's a huge undertaking. We, not only for the finance department, but for all of the departments, have to provide information to us. So after we're done with all of the meetings and the hearings and making the budget balance and all of that, there's the matter of putting together the document. And it is a huge job. And thanks to the efforts of Jennifer Garrett this year, we received the award for the 35th year. So thank you to Jennifer. And
We have an award.
we do.
You get your fish pay. I know. You need to.
I know they don't warn people of these things.
Kim doesn't like to either, but that's okay. Thank you, Jennifer, for carrying on a long-standing Saginaw tradition, and we appreciate it. Item number 8, Business Recognition Program Award, Keep Saginaw Beautiful Committee Program. Keith Reinhardt, Director of Community and Economic Development.
Good evening, Mayor and Council. This is a neat little program I wanted to just to kind of let the council and the public know about. Our Keep Saginaw Beautiful Committee has been around for, since I think it was developed in the mid-1990s, and they started with a lot of different programs, but they had for the longest time, they had a Yard of the Month program, and for whatever reason it stopped, but we're looking at bringing that back. But that program was set up to recognize our residents for the landscaping and such that they did to their house to make it look, a beautiful yard. And back in 2016, I became involved as liaison in 2015, but in 2016, they decided to start a program to recognize our businesses, which is a great idea for the new improvements that they're making to, whether it's landscaping and keeping up their yard if they have a yard, or trimming trees and such. And for a couple of reasons, didn't happen at that time, but the committee right now is looking at bringing that, reestablishing that program, bringing it back and recognizing our businesses. And they can be nominated by themselves if they want to be. Can be nominated by anyone in this room, anyone at home. You can nominate your friends. They can nominate you. But the purpose is just to recognize those that have done good work to improve the appearance of their business in Saginaw. And as an economic developer, I think it's a great idea, because that's one of the things that we're trying to do as far as building improvement grants and such. But this is a free award for them, and they get recognized. And just wanted to present that information to you. Some more information is going to be going out in water bills with the postcards that I put on your at your desk. Not really desk, your dais.
So this is just used as information?
Yes.
Okay.
Yes. We have more information on the award program, and it's all listed on our website, and we're kind of debuting it now. The committee wanted to wait until the spring. We could do it in the wintertime, but there's not as many people are planting flowers in December, although some are, but most are not. But the springtime was the best time. So, if y'all have any questions, I'll be glad to answer.
You got any questions for Keith? Cindy?
This is great. Thank you so much for bringing this to Saginaw. So how many winners, or how does this program work? Do you have like one winner a year, or is it a monthly thing?
Probably
How are they
monthly.
recognized?
The way that and the Yard of the Month program was stopped before I became involved. I don't know when it was, but it was stopped before I became involved. And you could have multiple winners, and I don't see why. There's some times when you would have multiple winners, and there's sometimes months you didn't have any because they weren't nominated. But I can see that you could have multiple winners per month for this.
And they get a yard sign or something?
Get a yard sign, similar to like what we do for the Adopt a Spot sign, same type of thing. We'll put it in their yard, and they get to keep it there for a month. Just you see that in some neighborhood associations and some in other cities, and it's one of those things. We're not recreating the wheel. We're kind of taking the idea from some other cities that actually we got the idea from multiple cities across the U.S. and kind of formed it into what we thought was best for Saginaw. So.
We appreciate you doing this. Thank you so much.
Sure. Well, Keep Saginaw Beautiful Committee. They're doing the work.
All right. Any other questions for Keith? All right. Thanks, sir. Keep us appraised. That sounds great. All right. Item number 9 at 6:41. We're in a public hearing. Continuation of curfew for minors. For that, Chief of Police Russell Ragsdale.
Thank you, Mr. Mayor and members of council. What we're asking for is a continuation of our curfew for minors. So state law requires that we do this every 3 years. This is roughly the 10th continuance. We passed this original ordinance in 1994. So that's what we're here for today, is to seek a continuation or a continuance of this ordinance. Public hearings required, two hearings on that, so this will be the first public hearing on it.
Okay. Any questions for the chief on this subject?
About how many minors do we have each year, and about what age are they?
So I didn't actually look at the ages. What we're looking at as far as citations, it's about 16 citations a year over a 10-year average. However, over the last 3 years, when you calculate COVID into that equation, we're looking at about 7 citations over the last 3 years. So it's not a tool that we use on a regular basis. Most of the times we can resolve this without a citation, contacting the parents, get kids back home where they belong. But when those kids become troublesome and don't follow the rules, then this is one of the tools that we utilize to rectify that.
So the first option then is to get the kid back home to his parents. May have snuck out or whatever.
Always.
You only write the citation as kind of last resort.
Yes, sir. And the ordinance is actually kind of written that way as well, requiring officers to make efforts to resolve this without a citation.
Any other questions for the chief?
I have one, Mayor.
Oh, yes, ma'am.
Real quickly, just for our the people in the audience and watching from home, what are the terms or the conditions for the curfew? Like what time to date?
So if you're looking at time frames, so typically it's Sunday through Thursday, 11 p.m. to 6 a.m. And then on Saturdays and the morning side of Sunday, it's 12:01 to just after midnight until 6 a.m.
Thank you.
Yes, sir.
Yeah, I know one time the bands years ago, my daughter's now graduated college, so they was walking home with their band stuff from Saginaw High School, and I think it was Officer Cuddles, Mr. Cuddles.
Couples.
Mr. Cuddles got them and brought them home.
Yeah, that's our first goal is just get them home safe. But if they want to cause problems in the city and commit crimes, then this is one of the tools that we utilize. So.
Any other questions, council? All right, it is a public hearing, so the public is encouraged to speak on this. You don't need to fill out a card. If you want to speak on this, you may approach the dais, the lectern, I guess, right now and speak. If not, at 6:45, I take us out of a public hearing, and I believe no action is required this evening. This was just the first hearing, right?
That's correct. That's correct.
So stay tuned. We'll see you again. Thank you, Chief. All right, moving forward. We're at item number 10. So at 6:45, we're back in a public hearing. Consideration action regarding resolution number 2022-08, fiscal year 2021-22, mid-year budget revisions. For that, Finance Director Kim Quinn.
Thank you, Mayor and City Council. We are required to amend the budget in the same manner that we adopt the budget. Therefore, we have posted the public hearing. We've posted the proposed amendments, and they've been described in great detail in the attachment, so I don't have a presentation, but I'm happy to answer any questions. We'll hold the public hearing, and then major budget adjustments will be, if adopted, then we'll amend the budget.
Council questions for Kim?
So everywhere in this document, where it says increase, that means we received those funds?
Yes, if there's, so on the revenue column, if it's a positive number, it's increasing, actually in both columns, and if it's a negative number in parentheses, it would be a decrease. And as you can see, most all of these items in here are either projects or line items that were not completed last year and carried forward into the current year, or items that the council has previously approved since the budget has been adopted. And if that's the case, there is a date next to that, the council date that the action was taken. And then in addition to that, there's the one-time retention payment that has been discussed previously. So those are the majority of all of the budget adjustments.
So with that one-time payment, it was two line items for that one. So it was like, the bulk of it came out of like the general fund or something, and then...
Right, the majority of it would be general fund employees, and then there are also enterprise fund employees.
Okay.
So the reason that there are 3 line items per department is because not only will we pay the award, the amount, then we also have to pay Social Security and TMRS on that.
So the Social Security and TMR comes out of a different fund than
A different line item.
a different line item?
Mhm.
Okay. So I guess then, I think one was like 80. I'm trying to go back and look here now.
The general fund total is just under 85,000, and the enterprise fund, which is our water and sewer employees, is just under 10,000. So the total would be about $95,000. So that's for the payment, either the $500 for full-time or $250 for part-time, and then the associated cost for Social Security and retirement, TMRS.
That would be on top of that 95? Or
No, that's included.
That's included?
Yes,
Okay.
sir.
Thanks.
Other questions, council? Any other questions? All right. Oh, okay. All right. So another question from council. This is a public hearing, so the public is encouraged to speak again. You don't have to write anything up. Just approach and the microphone and speak if you would like to speak on this item. Now's the time. All right, seeing none, at 6:48, I take us out of a public hearing and I entertain a motion.
Mayor, I make a motion that we approve the consideration for the mid-year budget revision as provided.
Okay.
I'll second.
Mr. Beasley, second. All those in favor, raise your right hand. Those opposed? Excellent. Thank you, guys. And I appreciate doing that for our employees. I hope it really helps on our employees.
When will they go out?
We really value our employees. All right, thank you, guys. Moving forward, item number 11. Let's keep it rolling. So at 6:49, back in public hearing. Consider action regarding adoption of Saginaw Parks and Rec Master Plan. For that, Rick Trice, Director of Public Works.
Thank you, Mayor, Council. Good evening. I was just sitting here thinking, I can't remember a time that we got to item 11 and I haven't talked yet. So
I don't want to leave you out, Rick.
kind of in foreign territory here. I'm not sure how to act. We're here for the adoption of the master plan. That master plan was, I guess, first identified in 2019 in the strategic plan that was approved by council as a line item to go back and look at the park master plan. The last one was completed in 2013. So and was actually dated for a vision reaching out to 2025, a 12-year horizon, which is too long for a master plan. The cycle should be probably a 5-year cycle, not unlike the comprehensive plan. But that work even started before Kimley Horn was authorized to go ahead and start that work. With the bond program, the park board was charged with coming up with some estimates for different ranges of funding for a bond proposition, and of course we ended up with a $4 million bond proposition that was passed by the voters, and so $4 million are available for park improvements through the bond. So just a little bit about the document, and I'll let Kimley Horn take the floor here in a minute, but you know, it like the comprehensive plan is a vision document. It's a guiding document. You know, it's a kind of a misnomer to call it a plan. It's not really a plan. It's more of a toolbox that the park board and the council can use to kind of see what vision is out there and kind of what the public has given in the way of feedback. Problem with it is, I mean, it's a snapshot in time. So a lot of the feedback that we got over the last year, and things change over time. So public perception, public wants and needs change over time, and so you know it needs to be flexible. But it does provide information for, again, the park board and the council to use when they're deciding what projects we're going to pursue and what level of funding that we're going to give and what level of effort are we going to take to make those happen. An example would be the regional park that we might apply through Texas Parks and Wildlife Grant. And that vision is in this document now, and kind of the process that we might be taking to pursue that. And that's just an example, but I just want to emphasize that although concepts are in the plan, those are not set in stone. I mean, you know, the park board and, of course, the city council has the final decision on what will be built and what will go forward in terms of a real project. So the capital part of that expense. So on November 3rd of 2020, the IPO was given to Kimley Horn, authorized for Kimley Horn to start that work, and they've been working diligently over the time. Several public forums and feedback has been given to the park board and other avenues or venues. So they're here tonight to present the plan, and with that, I'll shut up and let Kimley Horn come up and give their presentation, unless you have any questions for me.
Good evening. My name is Laura Presley. I'm a landscape architect with Kimley Horn, and I was one of the members working on the Parks and Recreation Master Plan. So, quick introductions. We did this in collaboration with city staff as well as Kimley Horn staff, including myself, Catherine Utek, who's here tonight, Trenton, who's here tonight, and Andrew Simonson. So a quick outline of what we'll be talking about tonight. We're just going to do a quick summary of the document, review some of the Parks and Recreation maps that are included, talk about some of the next steps, and then answer any questions you all might have. So to summarize, this document was created in conjunction with the comprehensive plan for Saginaw. So it includes a brief introduction and history of the city, and then moves into an inventory and analysis of the existing parks and trails, a needs assessment, proposed park and trail improvements, our recommendations, and then a future parks inventory and analysis, and an opinion of probable construction costs. So here you can see the existing Parks and Trails map compared to the proposed Parks and Trails map. The biggest difference will be on the eastern side of Saginaw, a proposed regional level park. So this would serve a similar purpose as Willow Creek Park is serving right now on the west side of the railroad tracks. Also of note are the trails in Saginaw. So right now, the city technically does not have any trails. They're defined as a 10-foot path, a 10-foot wide path or wider. And so right now y'all are looking at mostly sidewalks. So that's what we've documented here. Some of the proposed sidewalks are already included in current roadway improvements projects that are happening right now. and then some of them are proposed for potentially down the road. So looking at this slide, you can see the level of service that we have right now, as well as the proposed level of service. So the orange area highlights the underserved portions of the community. And you can see that with the proposed park improvements, we're looking at serving the majority of the community with some level of parks facility, whether it be a large-scale regional park or a smaller neighborhood park. Here we see a similar map, but focused on trails. So again, you can see on the left side with our existing conditions, that swath through the center that's underserved is kind of the adjacent to the railroad tracks area. And we're looking at eliminating a great portion of that underserved area by providing additional sidewalks, both on the east side and the west side of the railroad tracks. We're not currently proposing any railroad crossings for pedestrians due to safety concerns. However, if in the future that becomes something that's highly desired, we can look at incorporating that. So moving on to our next steps, as Rick mentioned, there was a bond package that was passed that included $4 million for park improvements in 2022-2023. So our next steps moving forward would be to revisit the original concepts that we did a few years back as part of that bond package, engage the public in surveys, workshops, meetings, because the last time we got feedback from them was in kind of pre-pandemic life, and so some of our priorities have all changed a little bit, and we want to make sure that what we're proposing is what Saginaw wants. We would also meet with the Parks Advisory Board as well as City Council to get your feedback and make sure that when we are updating the concepts, we're including what's important to you all, what's important to the Parks Board and the public, so that can be addressed and then developed into construction documents to take to bid and then construction. So next up, I just want to do a quick overview of the concepts that were included in the $4 million package so that you can kind of see what our starting point is right now and where we might start making changes. Yes.
So is the $4 million the $4 million that you're talking now, is that what was passed in the previous bond?
Yes.
Okay, so the $4 million that's spelled out in here is what's been recommended to be spent.
Yes,
we wouldn't have to ask for another $4 million.
That's correct.
Okay, thank you.
So looking at Willow Creek Park, the original concept included restroom improvements at the switchyard area, as well as additional parking near the Dream Play playground, and then a splash pad and pavilion near the Dream Play playground. If we move to the William Houston Park concept, you can see that we've included restroom improvements as part of the $4 million package. And then moving on to the Highland Station Park concept, we've included a restroom relocation and improvement, as well as a trail connection to create a third-mile loop on the west side of the park, and a trail connection to Basswood on the west side of the park, as well as additional parking throughout the park. So that's all I have for y'all. I'm happy to answer any questions you might have.
Council questions? Cindy?
Hi. I always have questions.
We took a citizen survey in 2018, and one of the huge requests was a fishing pond. And I did not see that anywhere in this document. Were you provided the information from that survey to see what the citizens had wanted?
I am going to defer to Rick on the fishing pond.
I knew I wouldn't get off the hot seat tonight, but no, we had looked. In fact, we had brought proposals to council about a pond in Willow Creek Park. It has been bannered about, as I understand, for years, and has brought to council, and we could go forward with the pond. I mean, I think it's a neat idea. The issue with the pond was always the permitting requirements associated with the pond. So you're impounding water, and you're affecting water to the United States. I mean, so all those environmental sorts of permitting that would have to take place. But certainly, if that's the direction, again, if the park board wants to consider the pond, and that's what I say, there's nothing set in stone in this document. If we want to go forward with that sort of proposal, we could put together a scope for Kimley-Horn just to kind of take it a step at a time to identify those costs, because it's a process to get there. So I don't think that we want to just say, let's do a set of plans, build the pond. Let's go ahead and see what it would take to go ahead and get it through the permit process, and then complete that work, and then we can move forward if that's the direction that the council wants to take.
Well, that's the direction that the citizens pointed us in, is why I brought that up. And it's been in more than one time that we've surveyed the citizens that has come up.
Yeah. Well, in 2018, we have, I can't recollect exactly when we brought it back to council, but it was the same thing that I just described, that for those reasons it didn't move forward at that time. But, they had surveys since then that were part of this master plan that, whether it received any attention, I really don't know off the top of my head. But again, that it's flexible, so we can make anything that you want to have happen, provided the funds are there.
Well, sometimes where it floods might be a good place to put a pond.
There you go.
Just saying.
Yeah, you're halfway there. And this question is probably for Mr. St. Clair. I received a phone call a couple of weeks ago, maybe a little longer, saying that the Parks Board passed the Parks Master Plan, but they did not want the splash pad in that document or included. Is that a true statement?
It is.
Okay.
Yeah, I think there's a general consensus among the Parks Board that splash pads are fairly costly. It would chew up a lot of the funding that's there.
And they're seasonal.
There's maintenance issues. The Arlington boy a couple of years ago that died from the brain-eating virus, I think that is still stuck in our minds and is a consideration. So I don't know that there's a whole lot of support for splash pads on the advisory board, and frankly, I believe that that's the opinion of the public as well. I think the perception has changed since the original public feedback was put out there.
I agree. And I'm also looking at the minutes that were provided in our packet. It says that a motion was made by Member Weaver with a second by Member DeVille to table this item until the next meeting, and the motion carried. So I was just...
Correct.
That is correct?
Yes.
Okay, but we're still bringing it here tonight.
Well, so those are the published minutes, which we approved at our last meeting. We also went over the master plan at our last meeting, which was, what was that, 2 weeks ago? So those minutes haven't been approved because we haven't met since then.
Okay.
So what you're seeing is just the published minutes.
Okay. All right. Thank you.
Mr. St. Clair, I had a question. So, does the Parks Board have a list of what they want to spend that $4 million on?
We haven't officially started going through it. We wanted to get the master plan kind of in place before we started evaluating. And I think there needs to be some revisions put in there. I know that there's a lot of support for things like expanding the switch yard and making some improvements down there, especially with the restrooms, expanding parking if needed, expanding to another pavilion. So those kinds of projects. I think the restroom was in the master plan, but I don't know that anything else was.
Okay.
So, I mean, you got my question, so it's quite a few pages, but one of the things that I don't have in here, and I'll just be honest, I gotta have, is I need to understand what shape our current parks are in, the playgrounds, everything. And so to me, I'll be honest, I was a little disappointed when I seen it had a list of stuff, but it didn't tell me what kind of shape it was in. It didn't tell me whether it was an excellent, good, fair, or poor shape. And it didn't tell me what the expected end of life was. So, you know, if I'm sitting here with a playground over in Opal Jennings Park, or Opal's Park, and it's been there for 20 years and it's fallen apart, I want to go fix that before I go build a new shiny one over here. And it's very hard for me to understand that when I literally, I have, without, I mean, I can tell you the parks by me, but some of the others I don't know. And there's several things like that in here. Now, I know that you say that the park board's going to go here, and I know we said this is kind of a guiding document, but when I read it, this document says we recommend we're going to spend this $4 million on this. So it kind of leads you down a path, you know, and that concerns me in here, because a lot of the things with the $4 million, definitely over in the Highland Station area, that's kind of close to where I live, got major concerns with that. In fact, the concerns are so bad that I could not support this with those in there. So
I'm going to try to comment on that and get myself in trouble, but I'm a short-timer, so really I don't. You know, if you look at the playground equipment throughout Saginaw, the 7 parks, I mean, they're all past their useful life. I mean, they're other than the All Abilities playground, you know, everything is probably not up to city code. So, I mean, if we took a snapshot and did some sort of assessment, well, number one, you wouldn't have enough money, or at least program. The $4 million is not going to touch it clearly to replace all the playground equipment. So it's one of those, you know, if it's not up to code today, you know, it still has utility. People are using that equipment. If it's not dangerous, then we're not going to shut it down or take it out. We'll continue to operate it. But as soon as we do an assessment, say we did an assessment for all 7 parks today, it would become dated that day. And if you don't do something right away, I mean, that assessment is worthless, you know, a year from now. But I can tell you, I can almost guarantee that almost every piece of equipment out there is really doesn't meet current standards. So, and would have to be updated. So, I mean, if that was the basis for your assessment, is whether or not it meets current code, then, you know, but it's kind of like it's grandfathered so long as
I mean, I'm sure a tar swing don't meet code nowadays, and I wouldn't have no problem with my kids swinging on it. But if the tar swing had a wore-out rope tied to it, now we got a problem.
That is a problem, but that's not a. I mean, that's a safety issue, and that's something that we would act on immediately. I mean, upon learning that. So, I mean, I'm not sure again that the assessment really kind of yields the value in terms of, you know, what are the priorities citywide. So, the priorities citywide, you know, $4 million is not a lot of money, and today's rate, especially with inflation, is becoming less every day. So, if you really, I think the next bond program, and I think the city manager agrees, there needs to be a focus on parks, parks and playground.
And that's really what this plan tells us, is that we have needs beyond whatever our budget is, whatever that $4 million is, that we will need to do a park bond in the near future. That's sort of
right.
what my takeaway from this plan is.
Right, and you'll notice that some of the other parks, other than their existing conditions, you know, there really wasn't a plan in this master plan to how those might be treated, and that doesn't mean they're not fair game for the park board to make a recommendation. When the bond committee met, the special committee and the park board looked at all the parks and concepts for all the parks, and had lots of community feedback and public meetings and et cetera, et cetera. So that information is out there. They've got a lot more in their toolbox than just this plan. I mean, there's a lot of data out there that they can use. So, but just wanted to try to respond to the condition assessment, because I think it's just, I'm not saying it's a wasted exercise, but I think it's just recognized that all the parks need attention.
So, I'm struggling. I'm the new guy still, I guess.
Sure.
So, we've spent since 2019 on this, right? Is that correct? COVID, non-COVID, don't care. And what you're telling me, if I understand that, correct me if I'm wrong, that, yeah, this is overall a guiding document, but as soon as we vote on whatever we're voting on, then we're going to go off and figure out what we're going to do. So why did we just spend 3 or 4 years putting this together if we're not going to follow it? So, I mean, I look at this, and when I look at what they're recommending to do for the $4,000, I'm expecting that's what we're going to do. That's what I'm voting on.
Yeah, right. It's a vision document, and it was. They actually started their work November 3rd, 2020. So, but it was preceded by other exercises that kind of led up to this document also. But again, this is not a plan. It just happens to be coincidentally coming to fruition at the same time that we have $4 million available in the bond. So I mean, so it's projecting out the 4 or 5 years that we would utilize those funds and build something. Just
So Brent, from a legal standpoint, I say I vote yes on this, and all of a sudden, let's say they go in and put a parking lot right in the middle of Highland Station Park. I get told, oh, well, you voted for it. I mean, does this have to come back up, or when I vote for this, since it's in here, can they put a dadgone parking lot in the middle of Highland Station?
Sure. I mean, so if Highland Station is a city-owned park,
yeah,
then that needs to come to you all to decide. But you could vote to install a parking lot in the park, notwithstanding this plan, because this plan is not binding.
And I might add to comment, anything that we, like I said, it's a misnomer. This is not a plan. So if you approve this document tonight, it doesn't say that we're going to do the $4 million concepts. The park board still has to take this plan back with the existing available data and formulate what the program is for the 2020 bond. To come back with a capital plan that these are the proposed recommended improvements, and you guys have a shot at that to approve or deny or modify however you see fit, and that's what's binding. I mean, that's what will go forward to construct. So what you see in these concepts might not at all resemble what's being spent, for the $4 million.
I mean, I would have been a lot more, excited if it is that to see more what ifs. Like I've heard talking about we could possibly get the old gun range. I mean, I know that ain't a full, but it's an ideal. And to me, why isn't it in here? Along with some of the others, like she mentioned, the pond. Doesn't mean they're going to do it, but if this is just an overall what if, well, these things should have been in here for us. I mean, at least broaden our thinking to look at it. It's
and add it to the wish list. Like I said,
Yeah,
there's
it's-
plenty of
it's just a
surveys
wish list
taken of the city
things
that are not
should have been
included
there.
in this document. The
Yeah, I
citizens
think-
have spoken. We spent a lot of money to hear what the citizens said, and it's not included in this document.
Well, I think that, again, the East Side Regional Park that was spoken about is a vision, and I think the gun range and that property along Blue Mountain Road is part of that overall vision. I mean, but that's relatively still undefined in terms of how that's going to be structured and what that's going to look like. Because, I mean, it's going to require acquisition of properties that hopefully happen voluntarily, but if they don't, if we have to do acquisition, then that's more cost. So, I mean, again, that's the dynamic nature of this document. Yeah. But you're right. The opportunity is out there. That still has not happened yet. But a long-term vision, I think you're right. It probably should be added.
This is a long-term document.
Sure, it is. Well, it's a 5-year horizon. Yeah.
It's got 5+ in here.
Yeah.
Yeah, because I thought the first two, and then the
Mention
other
that,
things
Charlie.
like the tying the sidewalks, or I always call them trails, and then adding the extra parks, the big park there, and then the little park. That was the 5+ plan, right? So I mean, to me, those were, boy, look what we could maybe do. So to me, the only kind of solid one was the 5 and earlier plan,
Right.
which was the $12 million.
Or 4, but
Yeah, 4 to 12. I guess you could say 4 to 8. If we wanted to go up to 12, we would have to vote on an extra $8 million, right?
We're going to call you and get your check.
That's right. Talk to Ann on that.
Well, another thing that, and Charlie brings up a good point, which you need to mention. Why do we have this plan? What does this do with funding? You want to mention that?
For government funding, and this could even go all the way to the pond you're talking about, we can get the state, the state, wildlife to stock the pond. If we don't have this, we don't get that funding.
But it's not
that
in
is
the book.
that is correct. If you,
What we should do really is take the word plan off the top of this book.
Yes,
Because that's what
It's
it
not
is.
planned.
It's a book of ideas.
it's a wish list.
I mean, what I'd like to see, I agree with you, is a book of ideals. What I'd like to see is this book of ideals actually expanded to true ideals. More. Put the pond in your, kind of give us a concept of what it could be. Put the other one in there.
Because they spent a lot of time. They spent a lot of time on this, so. And that's what the Park Board Advisory Committee should put in here, what the citizens want.
Right.
Well, back in, what was it, 2013, when we had the previous?
Yep.
There was a 12-year plan, and on that 12-year plan, it got broken down into a 5-year plan. And was it the third year? I'm looking at the Charles because they were both on the Parks Board. The pond was on the year 3 plan, and it never happened. But there was never funding available to get us to that point. Every time the pond has come up, it's fallen because of some other reason.
But I'm sure there's places where you can get grants and stuff like that for wild nature and all that stuff,
Yes.
especially nowadays, because we've gone back.
And I think a big reason why we didn't see it mentioned in this one is because the community didn't bring it up.
Yeah, but if you
But
look
they
at-
did.
Yeah.
They did.
It-
They brought it up in the
the-
Citizen Summit. They brought it up.
They
but
brought
I
it up in the Citizen
talked
Summit,
about-
but that
But
was
not
not
the
a part
Parks.
of the Parks Master Plan agreement. So the discussions with Kimley Horn, when they were taking the feedback, and you can step in and correct me if I'm wrong, but if citizens didn't mention it, those 87 people that responded to the survey didn't talk about the ponds, then Kimley Horn didn't include it.
So
So-
let's talk about that, because now you're getting into a little bit of statistics and statistical analysis. And a lot of these charts in here is dealing with 3 or 4 people. And to be statistically significant, okay, you must have at least 100 samples. Now, I'll take 80, but when you drop below 50, you're actually supposed to put an asterisk in your paperwork showing that it is below the threshold of being statistically significant. And when you start getting down below 10, boy, you got to be very careful looking at that. So here we are with some of these where it's like 3 or 4 sample rates. Of course, if you go by percentage, 50% of the people responded. Well, 3 people responded. You see what I'm saying? So we got to be careful here when we're looking at data.
well, and I would say though, even the Citizen Summit and other past surveys have had the same statistical challenge. That you just don't have the
But if
the data
we just-
points that you need to make a conclusion.
But if this is just not just, but if it's not a plan, but just our long-term possible vision of the way we could go, there'd be nothing wrong with putting that in there and putting the others in there too and doing it. And like I say, and also too, even if it is, it would really be nice to understand where we're at with our existing infrastructure within the parks.
Correct me if I'm wrong, but if I'm not mistaken, most of the equipment in our city parks is past its usefulness. I mean, if we went out now and started trying to replace all of that equipment, $4 million is going to make a dent in the bucket. Because most of the equipment that we would be having to put in is going to have to be somewhat ADA approved.
It all will have,
This
It'll
old
all have
equipment
to
out
be.
here that we've got is not.
yeah, it'll all have to be ADA now.
Yeah.
It's the state law.
Well,
So that's what I mean. $4 million is not a drop in.
Then we need to come up with a way to come up with some more money for it.
Yeah. I got about $3 about all my wife gave me today, but then,
But we don't have a
So,
final
so
one.
here's,
Yeah.
Put the money
here's
in.
the thing. If we don't take assessment where we are, we don't know where we are, we don't know where to start.
Yeah, but
We don't know where to
about
begin.
we are.
Yeah,
But it's not documented.
No, it may not be documented, but I can tell you Rick knows where we are, Brack knows where we are, Charles has a really good idea, and I do, because we were both on the Parks Board. And this equipment is old and outdated.
so what do we do about it?
You have to replace it.
You have
$4
to
million
replace it.
is not enough money.
Well,
We're not arguing that.
Mr. Mayor.
Let's step back. This is a large picture plan, master plan. So let's step back for what it is and what it isn't. Let's be careful. This is not a get in the details plan. It is a big picture plan for potentially what we could do, what might be good, what the citizens want, what might be feasible. It's a, as you said, vision document is probably a better way to put it than a plan, but be that as it may. So let's be careful when we dive into all this other details, because that's not what this document was for. This document is to give us guidance going forward. The council and the Parks Board guidance on what we could potentially do, what we might need money for. And we mentioned the $4 million. That's what we have today. I think we all recognize that in the future we will need a park bond. Size of that, I don't know. But this document will help us get there. Will at least be a starting point to help us get there whenever we want to do it in the future. So let's keep that in mind before we nitpick this document together too much for what we want and what we don't want. There's some things we brought up that can be action items that we can take off to the side. This document, notwithstanding, we can add stuff. We can say we want to do this. We can put the fishing pond. We can talk about other needs assessment. But this plan as it is a separate document that has a vision goal. Let's just be careful that we keep on the rails as what it is and what it is not. So I think we sort of strangle a bit. And I'm sorry, Gabe, you had a point you wanted to make?
Yeah, Mayor, that summarized everything. Just want to remind the council again, this is a vision document. To emphasize Rick's point, if we were to make substantial progress on the wish list that are noted, we would have to bring it to voters. We just don't have the financial capacity to do that. So I think the process that the City Council chose to approach our last bond election is sound. That is, if the City Council recognizes this as a need and desire, we set up a committee. To your point, we kind of get some, like a takeoff list, a project takeoff list to understand costs, and then bring that to voters. So the utility for the plan is to be able, as Councilmember Tucker mentioned, potentially leverage this document for grant opportunities in the future. Some of the future park amenities that have been discussed, we don't have ownership or control of the land right now. We may in the future. The old gun range property was mentioned. That's actually owned by the the adjacent area is owned by the school district. We're still working through the tax sale, so it's not a be-all, end-all. Some of the Parks Board, be careful what you sign up for, sir. $4 million in a bond, it sounds like a lot, but when we talk about these simple, not very glamorous, exciting things like ADA improvements, restrooms, that sort of thing, there's a Highland Station Park. We have a slide that's been broken and obsolete. We can't get replacement. So there's more needs and wants than what we have funding. But it's a starting place, and each item, the city attorney mentioned, we'll take it in pieces and parts, and you'll approve or review at that time.
Well, maybe they can rename it from a master plan to a vision plan for Saginaw, so that way.
Doesn't it have to be called a master plan for the funding and everything else?
Because a master
Or no?
plan sounds like it's set in stone.
Sure. No, that's just semantics. We could call it a vision statement or.
So it doesn't have to be called master plan for anything? Okay, I wasn't sure. All right.
Maybe, would that make y'all feel better?
If they update the vision.
Yeah, okay.
Oh, yes, Mary, I'm sorry.
Changing the subject, I'm interested in trails, and I really enjoy looking at these maps that show the proposed trails. And, like Rick said, $4 million sounds like a lot of money, but it isn't. So I've thought of a way to maybe save some money, and Rick might be able to tell me if I'm barking up the wrong tree. On Willow Creek Park, there is proposed trail which would eventually connect it, the north end of the park, to eventually connect to that William Houston Park. So we're already going to be doing improvements to Knowles, and we'll have equipment out there. So I'm thinking it would make sense to complete that trail while we're working on Knowles, and wish list, could we take that out of the road budget instead of the park budget? Or share it?
That's a Kim question.
I just saw the consultants in the room smile because that sounds like more design fees.
I will say that Knowles includes sidewalks as part of the scope of the project. So sidewalks will be installed on Knowles. That will likely be the route for that trail system. You'll have connectivity at Park Center with the sidewalks there.
So that's actually going to be done already.
Yes.
And it's
Knowles
shown on
will
this
have
map
sidewalk connection right
as,
to its length.
you know, it's going to come out of the road budget, the street budget, I guess.
The sidewalks will, yes, sure.
Okay.
And which would be the trail.
Well, then that will accomplish a very small portion of the trail wish list. So I think it would be wonderful if we could do all of these trails, you know, where they connect the whole city. Don't have any idea how much that would cost, but I think that would be wonderful.
Cindy, do you have any other question?
And, speaking of trails, I wanted to talk a little bit about that too. We have a lot of developments coming in, but the connecting trails are gated inside, so they're not, us who live outside that community don't have access to continue walking on those trails. And that's a concern for me, and I would love to see the developers open that up so we can have continuous trails. But I've heard from a couple of other citizens over on the east side that with the apartments that have gone up, and this is a question for Kimberly Horn, it has created like a sound tunnel. It's like an amphitheater now that the apartments are up there. So voices and sounds are echoing off of those apartment buildings coming back into their homes that they didn't have before. They expressed concern about the basketball courts, the pickleball courts, all those things going in behind their homes. Are there any plans about some noise deafening trees and landscape and things to kind of reduce the park sounds? Because he said people talking normal, it sounds like it's inside their house.
So if there were to be park improvements, as part of that process, there would be public engagement, and if that was feedback we got, we could provide potentially landscape buffers or more trees to help buffer that sound to prevent echoing, but that would be something that would happen as part of the development of those specific plans for a basketball court or a pickleball court.
But again, that's part of this vision here, so.
Well,
I mean, I know I'm speaking on behalf of some of the citizens because they asked me about it, because this document was online for them to look at. And so I'm just sharing some feedback to you right now.
Yes.
That this is a concern for several neighbors whose property backs up to the park.
Yes.
There's not a buffer there?
I'd like to apologize. My 7 and 5-year-old, Rosie and Felix, we played tag at the skate park, so it may be me. I understand the concern, and I know what you're talking about. That is about as far back from the single-family residence in the park as we could get. But if I understand correctly, we could put, a potential improvement, some screening, shrubbery, or what have you, if that's a desire.
I do know, just remember I asked you all the other day, I had a citizen ask me if they was going to put a wall up around the apartments, and I guess maybe that's where that was coming from. When I was at the park, they bent my ear.
Yeah.
They're putting it up, but it's going to be wrought iron. It'll really dampen that sound.
Well, maybe they'll put some shrubs on one side of it to help that.
But again, that's not an apartment issue, other than the fact that the apartments are new, and that's creating.
Can the developer not put something there, like shrubs or something?
We can't.
Sun landscaping, just not.
Yeah, but I don't think we can require them, and I'm not familiar. Maybe our landscape architects friends are of any other sound screening citywide. We don't have any in Willow Creek Park. We would have much closer adjacent.
No, I think the only.
But they don't have the apartment, that's what they're saying. Is that what they're saying, is it's bouncing off of the
It's like
apartment?
echo from the
Like an
apartment.
echo.
If they're talking, it goes bounce.
Yeah.
Really?
You have traffic noise from Blue Mound Road as well, in that area.
You know, I would speak to that too. I guess, the zoning ordinance requires that when you have any kind of commercial use that's abutting residential, then you have an 8-foot screening, either masonry or wood, which was, would help serve that purpose. The apartment complex abuts the school district property and it abuts the park.
Yeah.
It doesn't abut residential property, therefore, the screening requirement was not in place or required.
That's what I thought they might have had it, but, okay.
Well, these neighbors are kind of like the trains. They were here first. So,
As I've told many people, I have a rule book that I go by, and when the city council decides to change the rule book, then we'll abide by that. But, I mean, we're just playing the rules that we're given, so.
All right, so we've covered a lot of ground here. I want to try to wrap this up before we're here too long. So this is still a public hearing. We're still in a public hearing, have not closed it out yet. So if any citizens want to speak, I know a couple already have. Anybody else wants to speak? Now's the time, please. You want to approach? Come on up. Yes, ma'am.
I'm Deb Vopel, and I do live in Highland Station, real close to the park. And I actually do know many of you. And Gabe actually came for a Gabe Garage, Garage Gab. And I met Lee, and I met Brock. Rick came also. I mean, we had lots of people, and I think that was a year and a half ago. And we had lots of discussion about the park, Highland Station Park, so specifically what I'm talking about. And it sounds like Nikki lives really close to it also. We gave lots of ideas for things that potentially want for the park. Never, any place in our discussions was there ever adding parking spots. So, I mean, now that I understand this is not actually a plan, this is a vision, this is a very, that's just, I just don't even understand that. Why are we coming to talk about a vision when we have $4 million we need to spend? But, so I wanted to tell you about the playground. So we talked about safety, and it's true. We have 2 playgrounds, both have broken slides. One that is completely open, that I have slides of, that I have pictures of, that people could easily fall off. I mean, these are unsafe playgrounds, both of them. We need to have them replaced. Right. That's the biggest thing that we want. We have, in the past 9 months, we talked about the apartments have come, taken away a huge amount of green space that wasn't Saginaw's, actually. I mean, could be sold. I mean, it wasn't part of the park. We know that. But we've lost this significant portion of peacefulness. So now they're talking about this 40-spot parking lot, which would go right close to the skate park. It now would take a big portion of the little green space that we have left. So I'm here to speak strongly against the parking lot. We don't want it. Put the money someplace else. The things that we need is we need 2 playgrounds that are functional, that have slides. We need the dog park water fixed. Only half of it is water. We need landscaping of someplace in the dog park so you don't have to walk through mud to get to the dog park. It's inconceivable to me that we just can't fix these little things. The restrooms need to be fixed, and but I mean that certainly can be defined. That'll last. But this 40-spot parking lot, I just cannot tell you how I detest that idea, to lose that much green space.
In talking about where that's going to go, a lot of people who go to the skate park, they actually, in the afternoon, park in the middle school parking lot and just walk over the hill to it. That's what all the teenage boys.
So the parking lot that's originally there is not overrun all the time?
Never.
Okay.
I've lived there 25 years, and there's never been a time I've seen the parking lot full.
The only time
Ever.
I've seen that parking lot even close to full is when they let school out and parents are sitting there waiting for kids again to walk across the hill to get in their car to drive off.
There's 68 spots in the parking lot that's closest to the school.
Well, that's good to know, so that when it comes up for a vote, you know.
Yeah, I
If
mean,
it's
there's-
overrun all the time, that's one thing.
There's 14 at the other end. There's handicapped at one end. There's handicapped in both of them. I mean, there is plenty of parking there. Do not take my green space. I think that's all I wanted to say, but if you want anybody in our area to ever vote for any sort of bond, we need to get something besides a parking lot.
All right. Thank you, ma'am. Appreciate it. All right, we're still in a public hearing, so anyone else wishes to speak, please.
Thank you. How are you? My name is Paul Richardson. I also live in Highland Station. I actually live right across the street from Deb. She's got me involved in this stuff. It's pretty interesting. I've emailed Gabe a couple times, and I wasn't planning on speaking tonight. I just had one question. You said that within the city code, Mr. Trice, that if there's a highway or a large apartment complex, if it's abutted against something or a residential neighborhood, they should have a wall. What's the definition of abutting? Because I can tell you, my house literally is on Trinity Trail on the corner of Stafford Station. My backyard looks at, the basketball courts. And now it looks at the apartment complex. And I wasn't even thinking about this, but the other night, they had the lights on back there, and it lights up they had the lights on one of the buildings. I think there's 4, maybe 5. It lights up the entire area. So what's the definition of abutting to keep that noise from our neighborhood?
Abutting means a shared property line, so if, just like your neighbor, you and your neighbors share a property line, your lot abuts his. So for the apartment complex, the shared property line, again, is Highland Station Park and the school district property.
So it doesn't matter that it affects us.
So there's a buffer, if you will, between you and the commercial multifamily use, the apartment complex.
I invite anybody that wants to come out to my house. We always hang out. Come hang out in my backyard and see what I'm talking about.
Can I ask you a question? When you say they have the lights on the apartments, is it lights up top or something?
So they were working on, they have, I think there's 3 buildings, 4 buildings, maybe 5. So they only had one of them on because they were working at night. I guess they ran over and they actually had the electricity.
So they're working at night with lights on? Can they do that, Rick? Yeah.
Work.
And if they have to have lights, can't they use them directionally where they don't?
Was it off? Sorry. Thanks, Trent. Keep me straight. Yeah. I'm sorry. Your second question was?
If they are working when it turns dark, don't they have directional lighting where it doesn't affect the houses behind them?
We can make that request. I don't know that we have anything in the code that would
Is there
require
not
them
something in
to.
ordinances?
I don't think that was my point. My point wasn't they were working at night. I don't care about that. I'm sure the citizens don't mind. It's temporary.
Well, all I'm
My
saying is
point
when they,
So if one of the building's lights were on, and in a handful of months that thing's going to be occupied, and all 5 of them are going to be on, plus parking lot lights, right? You're not going to have any privacy back there or any kind of rest back there, right?
But-
You're talking about 5 large buildings smack dab in the middle of what used to be a peaceful park.
I know, but isn't our ordinance when they have lights up like that, don't they have to be directional where they're not? Or maybe I'm,
When we have SUPs and we have, again, commercial adjacent to residential, for example, yes, we require downlighting, directional lighting.
Should be down.
yeah, that's what I.
Yeah, and we can investigate to see what kind of lighting they have. I'm sure they would accommodate downlighting. I mean, they just want security is what they want. So,
I think I was thinking about the.
but they may have parking lots with lights down. I know that they have parking lots on the Highland Station side of the development, so those will likely have light standards. But again, those can be directional.
Yeah,
they can
directional,
be downlighting. So.
Only thing I wanted to say is that if you were going to do something, it'd be nice to put some kind of trees, some kind of barrier between us and that apartment complex. Because if y'all haven't seen it, it's not the greatest looking thing in the world.
Good neighbor policy. I would love to come see sometime.
You're more than welcome.
Thanks, sir.
See me after, I'll give you my
Hey,
email.
so we talked about their fence is going to be wrought iron fence. Is it too late for us to ask them to put a wood fence? And if we did put a wood fence, if they did, would it do any good as far as from a noise canceling? I don't know. I have my doubts it'd make that much difference. It
What
might
would
help.
buffer the noise best?
Trees.
Trees?
Bunch of trees. Yeah.
Yeah, I don't know. I'm not an acoustic expert, but I mean, I can't remember what the elevation difference is, relative to the park, but, sound could easily travel over, especially if you have multi-story structures and sounds associated with that, so.
The school and then the park.
School on the west, park on the south,
Once again, we might could talk to some nature people, and maybe the school and both of them would agree to put some trees.
I mean, we can make the request. I mean, to do a screening. I mean, I'm sure a wood fence is cheaper than wrought iron. So, for budget purposes, they may be okay with that. But
if we think it'd make a difference, let's ask them.
It don't hurt to ask.
I'm not sure that it'll make a difference. I mean, but again, in good faith, we could ask.
It might not be a panacea. Yeah, it might not be.
I just don't want there to be an expectation that we're going to put up a fence and that's going to solve the issue.
Because it might not.
We don't know.
Yeah, it might not fix it.
But it doesn't hurt to ask, and then you can let us know.
Okay. All right. So back to the park. Any other park questions? We're still in a public hearing. So any other questions, comments from folks? Council, any other questions for staff or Kimberly Horn or Parks Friends? Cindy?
I have one more question. Why is it costing $440,000 for a bathroom?
440 million.
Million? No, thousand.
Thousand.
Yeah.
At William Houston Park?
I think it's because they're pre-made and inflation.
440,000?
It's a COVID tax.
Y'all need to find something else to use.
I will tell you, without defending their estimate, but the restroom facility that we put in next to the food truck park, that was prior to the food truck park. That's just basically a 1 or 2 restroom unit. I mean, that was a prefab unit that was dropped in. It was $80,000, and that was, I don't know, 4 years ago. So they're not cheap. I mean, everything has a sticker shock to it.
So this restroom would be just like that one, but
it would be a larger restroom. So that's part of the cost there.
How many people are there? I mean,
They have showers.
It's the soccer association which draws a crowd, especially if we do improvements of that park in the way of soccer fields, and that will even grow in popularity. So
are we going to be charging the soccer association to use that
that's
park?
beyond my scope. That would have to be.
Or if they're not, then I think they need to pitch in.
We have had discussions with the soccer association. They will never come up with enough funds to really make a meaningful participation. They pay a minimal fee now with our contract with the city, and Keith manages that contract, so maybe he can shed some more light on that. But
I know soccer fields are extremely popular. A lot of people like their little kids in and things like that.
But also, we don't know what the cost is going to be for that restroom. That's an estimate. Hopefully, it's high estimate. I don't know until we actually dig into it. We won't.
Right. We hope so.
Yeah, don't know. No.
20 stalls? I mean, is that what y'all putting in?
All right, council, other questions? Oh, you come to talk? Okay.
Katie Johnson. So the soccer fields, just to answer kind of some of it, when you're looking at restrooms for soccer fields, with as many people are going to play on it, you're going to have multiple stalls. They're going to have to be good sized because they're going to change in those restrooms too, all the time. Unfortunately, you're probably looking at a double-use restroom, and William Houston is in such bad shape with the fields that even if they come in and help us, I don't know if we get a lot of use on those fields. 2 single-use restrooms would never be enough for it, ever, truthfully, if they get the soccer association really going in there. When it comes to the master plan, I know everyone's hooked on this master plan wording. It's the same as a comprehensive plan. It's a plan. It's an idea. It's what we want. It's what we'd love to do. But when we were doing the bond and the $4 million, the one question I always got asked is, what are you going to spend the $4 million on? What are you going to do? What are you going to do? We had no answers. This gives us an answer of what we could do. And everything in there is, if we spent $4 million at Willow Creek Park, this is what we can do for $4 million. We could spend $4 million at Highland Station. This is what we can do for $4 million. So if we're going to ask the citizens to ideally let us have more money in a bond package somewhere along the future, and I know bonds are a very sore topic and nobody wants more money, we have to have something that shows where we would put things in. Is it going to be perfect? No. But we're going to go back and say, okay, this is what we're thinking, so let's look at it and go. The wood fence, the only thing I'd worry about is durability. Who's going to repair it when it wears out? Trees are your best options, but look at what the houses by the airport did and see maybe if that's a soundproofing solution as well. Because there are houses right at the end of runway A of DFW Airport, and they don't seem to have too many problems with sound.
What'd they do?
I want to say it was a giant wall, but I just can't. It's been a minute.
Okay.
But you could look and see, because they're right at the end of runway A. They're $600,000 houses.
Yeah, I think it is a big wall.
And I think it's a big wall, but you could look at something like that. So what I would tell you is look at some other cities, look at some other towns and see what they did to help with that noise, because nothing is perfect. Rick, I got a question for you. In Belt Mill, and I could be wrong, so correct me if I'm wrong, didn't we have in the plans for Belt Mill that there was going to be a community center and a couple of ponds at the Saginaw entrance?
There is a pond at Saginaw entrance.
There are
Could
two
that be the
ponds.
fishing pond?
I don't know, I asked him for decks, but, the guy looked at me funny.
I'm just thinking out loud. I mean, if we have the pond going in at Belt Mill, could that be the fishing pond? And
I think the developer has talked about possibly stocking those ponds. Yeah, they're going to be a static water surface, so they will have water in them all the time.
I'm just thinking, I mean, maybe that's a solution that helps for everybody a little bit. Just a thought process
Good idea.
of that. So I love a fishing pond.
It's already being dug.
So
Okay.
I was just trying to remember, because sometimes I forget things.
No. Okay. Thank you, Katie.
Is the Soccer Association Saginaw residents?
I can't remember exactly what the percentage is, but a good percentage are, but no, not all of them are.
And, I mean, if they're not Saginaw residents? why
Yeah,
are
I
we
think
charging
50
them
to
for our
60% is what we recollect, but
I mean, we charge the Soccer Association a nominal fee. We don't charge them. We charge them a nominal fee. So, and they do not have a lot of money. I've talked to them. They cannot afford hundreds of thousands. So,
We're not asking, we're just asking for some
yeah.
help.
And we get lots of complaints about the quality of those fields, about kids twisting ankles, and somebody called it a cow pasture. And I know what a cow pasture is, and that's better than a cow pasture, but not much. So
There's no cows out there.
there are no cows, but it could be better, and we're hopeful that some of this money will look at the William Houston Park. But there's a lot of opportunities, as we mentioned. This plan, this vision document points out a lot of opportunities. So I think it also points out that we do need to seriously in the future consider a bond package for the parks. And I think it could be a very large bond package as I look through this and think about it as we talk tonight. I mean, we're talking, I thought 20 million at first, but that's probably low. So to do what we need. So other comments, other questions? We're still in a public hearing, though I'd like to get us out of that so we can move forward. Anything else public hearing wise? So at 7:48, I take us out of public hearing. Council, any other questions, comments we're still on 11. We have been on 11 for a while.
Yeah, I mean, just finishing up, I mean, like Katie said there, this gives a direction to the citizens of what we could spend the $4 million on. And boy, I'm having a hard time swallowing that. Because, like I say, totally can get behind the soccer field being cleaned up, things like that, absolutely. If a master plan, if it was put together, had some things we talked about, things like that, I'd be out there holding the sign saying approve the bond. But with the way this is now, and we've heard citizens talk, they've got two of their pieces of equipment that's broke. One, I know it's been broke for over a year. And from what I understand, they can't be fixed. We can't get the parts. So with that being said, and none of that's even in here. So to me, it's a stretch too far.
Is that piece still being played on and everything?
Well, yeah, kids will play on it.
Sure. So, yeah, one thing we didn't mention, certainly don't want to extend any longer than needed, but we have a certified playground inspector to make sure that things are safe for use. So the couple slides that are broken now have plywood on them, and again, they can't be replaced because they're obsolete. If the council wants to design a replacement or get a replacement for Highland Station playgrounds, we can do that pretty quickly.
How much can that part cost? How much can that one little specific area that needs to be
slide.
fixed for safety reasons to
Under-
tide us over until we can get,
100,000 maybe?
Yeah, it's probably somewhere in the neighborhoods of 75 to 100,000. We're taking estimates now.
Yeah,
We
because
don't
there's-
know where the money would come from. I mean, that's a question, but
are you talking 75 to 100 to replace it?
Yeah, you pull out the
to
whole.
replace, to
with
replace it,
new
put new
pole,
equipment
new
in,
thing?
replace, take
It's
out
not
what's
just a
there.
slide.
We don't have that much money in the park fund or anything to do that we
Why
can't?
can't we pull it
You
out
have
of the bond package?
$100,000 roughly in the park fund balance right now.
There's not
roughly.
anywhere else in our budget that we can't fix our playground.
The bond.
So,
Why
So-
can't, we can't take it out of the bond?
Okay, take it out.
So the charge from the city council was that again, pray for your volunteers here. The Parks Board would make a recommendation to the council that $4 million, which is 1/10 of the 2022 current dollar, desires, needs, and wants. We haven't designed a thing yet. To say, this little amount of money, where do you want to put it? The general thought, I think, is worse first. So things that aren't glamorous, restrooms, accessibility, I think that's what they're thinking.
Okay, so my thing is that if we have a park that is not safe for children, and that's what they're built for, we need to fix that park.
It's a liability.
All the other stuff can wait a minute. Fix that park those kids can play on. I know a lot of our stuff is outdated, but it's still playable. There are some things that, they put graffiti and everything on it, but I don't understand why we're not fixing that park. Whatever, bring that to the city council so that it can get fixed.
If that's the desire of the city council, you will,
Yes.
you will make me a hero in my own household.
Let's get
For
that
that, I
park
thank
fixed.
you.
Don't y'all all agree on that?
Yes.
It's a park that's for our kids. Then I think that's what you need to do.
Sure.
And then we'll worry about spending the rest, 3-point-whatever million in a little bit, okay?
And I think the
Is
Parks
there
Board
anything-
has gotten our input. I think I've heard our input, so.
Is there anything that says we have to spend that $4 million all at one time?
No.
No, that's not what I'm saying. I'm just saying, whatever is detrimental right now to our children needs to be fixed. And I'm a child advocate, I'm sorry, but
So
it
don't,
needs to be fixed. That's part of our city.
don't mean to complicate things, but the $4 million for our parks money is not available, and Andrew will talk about this further until next year. We're planning on issue next year. But if you want to do a cash replacement of fund balance for a playground,
Can we not do that? Is that legal?
so,
We can do it.
no, of course.
We can do it.
I mean, I guess I'm still struggling is, they got 3D printers, and I know you have people, it seems like to me we could find somebody that would make a slide for us that would fix that. I could be totally wrong, I don't know.
Well, I'm not against replacing it if it's that bad a shape. You gotta think about the kids and the youth.
No, I'm
Yeah.
with you, I'm just saying,
Yeah.
at least we could replace the slides. There's gotta
Why can't y'all figure out exactly what it'll cost? See if we can't do a cash, whatever. Do that, get that part done, because you gotta have something that's our city. Let's get that fixed.
I think staff has
But
gotten guidance.
Again, we are proceeding along those lines currently with estimates to replace that piece of equipment. So, but
there's two
I
pieces.
don't know, we have 7 other parks, so I don't know. It's an unraveling sweater. So,
That's what I'm saying. The other parks have stuff that is probably still usable, even though it's outdated.
that's correct. And again, we have a certified member of staff that can determine whether or not a piece of equipment is safe or unsafe. If it were unsafe, it would have tape around it today and barricaded. So,
And how long would that last?
So,
So my thing is, each year we do a budget, each year you do evaluation. And these two pieces of equipment over in Highland Station that's broke, at the beginning of the year you go, okay, we have these two pieces that's broke, we estimate it's going to cost that much. It goes in, we approve the funding for that year, and it's part of maintenance.
I like that approach. In fact, if we can begin that process to go ahead and do some sort of evaluation on the most critical needs of playground, and then it's a budget decision. But which competes against everything else that's going on in the city, which you understand. So yes, we could go through that exercise.
Why can't we look into that and get that one?
Okay.
taken care
right, so we've got some action items here. Let's wrap those up and let's move forward with this item. So I think we've got some items we want to talk about. We've talked about the slides. We've talked about a pond. We've talked about, what else am I missing? Sound barrier. Touch base with them. I'm not worried about the gun range as much. We've also talked about this vision document, this master plan, which is what is on the docket tonight. So if there's no other questions, I will entertain a motion on the approval of the Parks Master Plan / vision document.
Mayor, I make a motion that we approve this under the involvement that it's just a vision. It's not set in stone. Anything that's going to be set in stone has to come to the council, correct? And as it was presented.
All right, do I have a second? Mary, second. All right, all those in favor, raise your right hand. All those opposed? All right, thank you, guys. Thank you, folks. I know it's been a long time coming. I appreciate the hard work. All right, item number 12, consider action regarding resolution 2021-10, declaring intention to reimburse amount not to exceed $23,700,000 for certain capital expenditures, moving forward with bonds. So that is Andrew Friedman, Samco.
Good evening, Mr. Mayor. Andrew Friedman with Samco Capital Markets. Serve the city as financial advisor. The action before you this evening is a notice of intention resolution to reimburse yourself ahead of a planned debt issuance. What this allows is the city to spend funds that are lawfully available from fund balance to begin planning, design, or construction of projects ahead of receiving the proceeds from a bond sale. Just handed out a timetable for you all for the planned $23.7 million general obligation bond offering from the successful election. We had our first bond issuance last summer in July. This is a second tranche of that voted and authorized debt that we are planning to sell May 17th of this year. Upon the successful pricing of those bonds and your subsequent approval of them on May 17th, the scheduled closing would be June 15th when the city would receive those funds. So any money that you expend between your adoption of this resolution and the sale of those bonds, you could repay yourself, repay the general fund, wherever you take those funds from, with those bond proceeds. This is really just a piece of paper for the city to have in its file, so to speak, should the IRS ever come and audit the city to see how you're spending it. If you never spend a dollar, and you're certainly not bound to, then this was just a simple resolution that you adopted and never used. The benefit of this is it allows you to repay yourself up to 60 days prior to the adoption of this resolution, so money that you've even already spent could be included in that and eligible to be paid from this forthcoming bond issue. It also allows you to go out 18 months. So it even goes beyond this bond issue that we're presently scheduled to sell and could go out 18 months from today's date, the date of adoption of this resolution. For some of your other conversations you've been having this evening, that could be a relevant tool for you all to remember as plans change. So again, that summarizes the notice of intention, the reimbursement resolution for your action this evening. On top of that, just wanted to brief you, obviously, the timetable here, proceeding with that $23.7 million bond offering. Again, would plan to be back here on May 17th with interest rates in hand, and that would be for you all to approve at that time and to obligate the city with the issuance of those bonds. To give you a little bit of an update, obviously inflation, fears of recession are a big headline right now and a concern for all. We have seen interest rates going up over the last 3 months pretty substantially, about 100 basis points, so 1% overall. If you think back to when we sold our first tranche of bank qualified bonds last summer, we locked in an interest rate just under 1.6% for a 20-year financing. Incredibly low interest rate, really probably the best that we'll ever look back on having secured. Right now, at $23.7 million, our interest rate would be otherwise higher because we're going to go above that bank qualified $10 million threshold in a given year. So interest rates are slightly higher just because of that. We're looking right now, I would say, about 2.75%. On a historical basis, that's still a very low interest rate when you start looking back at bond offerings going back 5-10 years ago. And what I think the crux of it really comes down to, when we went into the planning of that bond election, and we ran many different iterations as you all prioritize different projects, we are still coming at, even with higher interest rate, and we're planning for the other subsequent bond issues that we have planned all the way through 2025, we've increased the interest rate estimates across the board, and we're still better than our initial projections when you all adopted an ordinance calling for that bond election. So we're still in good shape in terms of proceeding with not just this bond issuance, but issuing all of the bonds that for all of the projects that the voters approved. And so I wanted to make you all aware of that. Certainly we don't have a crystal ball with where interest rates are going. One of the bigger concerns is getting a handle on inflation. The Federal Reserve has indicated that they'll consider 50 basis point rate hikes, and maybe many more of them through 2022, because they really want to get a handle on inflation. That'll naturally send interest rates higher, try to cool down the economy. So as you look at project costs and the dollars we have authorized, I'd certainly like to see some of those project costs come down, or materials and labor, things that we've seen really escalating over the last 8 months to a year. So with that, I'm happy to answer any questions that you have. Gabe or Kim, if I've neglected to mention anything that I'm supposed to.
Well, there's one thing we need to mention. We need to mention why we want to do this at this point. And I think Lee's got the answer for that as to why it's important to do it right now.
Yeah, thank you, Mayor. Just let me channel that into a quick update on the Library Senior Center project, which has a lot to do with the money that Mr. Friedman just spoke about. We brought in Byrne Construction a little bit early so that we could get them working directly with PGAL during the design phase this year. Byrne Construction, one of the reasons that the selection committee chose Byrne Construction is that they have a really good reputation of being probably having one of the best cost estimators in the business. And so we've been having a lot of meetings concerning the budget, the construction budget that Byrne will be developing. And in those meetings, it's been discussed that in Byrne's opinion that there are some materials that have gone up 30 to 40% since our estimate was set for the project. And then we had a meeting the other day basically where the discussion hit on the fact that that in fact nobody knows of a project that's going on right now that has not come in over budget from what it was estimated. Now that's construction, buildings, streets, everything. So there's also some indications that the inflation is going to continue into next year. So what Byrne has suggested to us is that they can start shopping for construction materials that we know that we're going to use and stockpile those. They have the ability to stockpile those prior to the construction beginning even, and they're willing to do that. So we'll be monitoring the price of the construction material prices really closely, and can buy some things, depending on whether the price is going up or down on that particular package or that particular material, and they may want to purchase some of those ahead of time. So that plays into the issuance of this money so that it's available for that.
Thank you, Lee. Thanks for the update. Appreciate that.
The last update, and this is related to this issuance somewhat, or it's related to debt projects. It's come to my attention that you may all be considering utility system improvements that are needed. And so I believe y'all are going to visit, or the staff's going to brief council on those future needs. These bonds can only be spent towards the projects authorized by the voters. Mm-hmm. There may be a need, you all be telling me, for borrowing additional funds that would not take place within this general obligation bond. That would be a certificate of obligation. As a reminder for you all, we have very, very little utility system debt. When I say utility system debt, I mean obligations that are paid for not from property taxes, but from the revenues generated by the water and sewer system of the city. So that debt is it's dropping by $80,000 next year. That gives you capacity to fund within the existing budgetary constraints, another $1 million in water and sewer improvements, and then we're completely out of debt on the utility side in 2027. So you've got lots of capacity there to do improvements for the utility system or expanding the utility system, whatever those projects may be, and we may be visiting about that further potentially when we're here on May 17th to consider this bond sale. So I just wanted to plant that seed. Happy to answer any questions you have related to that, but it is unrelated to the GO bonds themselves.
Council questions for Andrew? Cindy?
I like numbers. I like to play with them. You made a comment that because this bond is over $10 million, that we're paying a higher rate.
Yes, ma'am.
Is there any reason why we can't break this into $10 million?
Well, when you borrow, you commit to only issuing in aggregate for the city $10 million in a calendar year. Given the interest rate difference between bank qualified debt and traditional tax exempt or non-bank qualified debt, it's anywhere from between 0 and 15 basis points in a better interest rate. My professional opinion would be that given the inflationary environment we're in right now, the higher material cost that you're facing through inflation is going to have a far more drastic impact on the dollars spent by the city in support of debt or the overall project cost than you do by gaining that very minimal interest rate benefit. Again, if you borrow $10 million today at, let's say, 2.6%, and we borrow another $10 million next year, but interest rates across the board have gone up another 100 basis points, you would have been better off borrowing $20 million at 15 basis points higher at today's rate than staggering that out over time. Now, no one has a crystal ball, myself included, but that's the logic in the advice. And you've got project costs, frankly, that are very expensive. So I don't know how effective it would be borrowing $10 million at a time and realistically constructing the projects you all have desired to take on.
Okay. So you said these contractors have the ability to stockpile a lot of these materials. At one point in time, just recently, it was impossible to get a lot of these materials. I had friends that were building a house and they couldn't move in for months because they didn't have windows. Garage doors, they couldn't find lumber, carpet. Insulation was huge. They were going all over the world trying to find insulation to build these houses. Are we still looking at that as a problem, and how is that going to affect
that gets a little bit that gets outside of the scope of
So,
your finance guy.
But I mean, is that going to affect our purchasing power?
I can't speak to the procurement of materials, unfortunately.
Okay.
I just don't have any first-hand
Sorry.
knowledge of that. No, it's a relevant question. I can't answer it, I'm afraid.
Mayor, if I may, so you're exactly right. I mean, there are materials that will be difficult and that will be on order for months, potentially. We've talked about that considerably. So one of the things that the PJL and Byrne are working together and working with staff to do is to present multiple budgets with multiple options so that if we have to make changes in material construction or things like that, we will have flexibility to do that. And then also, so we're talking about from now through the design phase ending up somewhere probably around the first of the year before we actually break ground on the construction. So we have a lot of time there that things can go way up or level out either way. But all the indication is it's not going to really drop. So.
All right, one other piece to this that we have not discussed yet. So we issued $23 million in debt. That will have a tax hit. Kim, you want to speak to that, what the tax increase would be potentially?
I think Andrew's got some numbers too, but it's for this next year is the big one. We're constructing, so this is the biggest one, and we're looking at like 4 cents based on the estimates. Of course, we don't have our values from TAD yet. We aren't going to get our initial values until April, and even the April ones aren't very good. So we're not going to have a really great estimate on, but I can tell you, as Andrew reiterated, we did conservative estimates. We're still looking good. Overall, we estimated that the impact of the total bond package would be about $250 a year for the average homeowner. We're looking at, is it $75 for the average homeowner a year for this issue?
For this issue, I have it for the overall impact of the entire program, but 75 does sound right.
This is going to be the big year. I mean, people are going to see it in their next year's tax bill. This is the big one. This is the biggest chunk of that 250. But as Andrew said, the good news is we may end up less than 250 impact annually per homeowner for an average homeowner.
And one of the things that I look at is your actual interest and sinking tax rate. The portion of your rate just goes paid debt. When we put together the analysis and the plan that you all eventually voted on and what was communicated to the voters, the ultimate impact was taking your INS portion of your tax rate up to 32 cents. Right now, that's looking at about 30 cents. So about 2 cents under, and have increased the interest rate assumptions going all the way out to 2025 pretty substantially, and I certainly hope we don't hit them. But a couple of the things that we've also built into that analysis, we try to always be conservative. We're estimating that you're not getting very much growth. And we do that intentionally because as we get more growth, it allows us to manage that tax rate back down so that hopefully by the time we get through with this program, you all can look at your citizens and say, we thought we might go up to 32 cents in an INS tax rate. We never had to go that high. And they approved you to proceed with these projects knowing that that could be the impact. So as the city continues to get better growth that exceeds those expectations, we should be able to bring that the tax portion of the impact hopefully below what those expectations were set at.
That's a good point. So the revaluation will affect the tax rate, but the new growth is what's going to potentially make the tax rate impact or the tax dollar impact less for the current homeowners because more people will be paying.
I mean, there's no columnist out there that I know of that I've seen that says that the interest rate's going to stay the same or go down. Everybody's predicting to go up, some of them significantly. Yeah. To me, when you take that into account, along with being able to de-risk getting some of these potential things that we'll need to buy, the hardware, things like that. To me, this is absolutely an easy vote. And let's get on with it.
Yeah, any other questions for Andrew before I let him go? Thanks, I appreciate you coming in.
Thank you all very much. We look forward to seeing you in May.
We'll see you again. All right, so with that, I'll entertain a motion, folks. On item number 12.
Mayor, go ahead.
Go ahead.
I make a motion that we approve resolution number 2022-10, declaring an intent to reimburse.
I second it.
All right. All those in favor, raise your right hand. All those opposed? Thank you, guys. Thank you, folks. Thank you, Andrew. Thank you, staff. Thank you, Lee. Appreciate that. Let's make it happen. Item number 13, consider action regarding approval of master service agreement with Peloton Land Solutions for planning services. For that, City Manager Gabe Raham.
Mayor and Council, you recall you recently approved a 2022 work plan project list. One of those projects included city-initiated rezoning of undeveloped parcels. So I'd like to welcome back local celebrity from Peloton Land Solutions, Abra Nusser. She can answer any questions you might have.
Thank you, Gabe, and it's always nice to see you guys. So happy that you guys are doing more planning and more design. So here to carry on with implementation of what we began together. The Master Services Agreement does cover planning and design services and would allow us to begin those implementation efforts, namely, first and foremost, rezoning and any applicable code amendments that would be associated with that as well. So as we understand it, there are a lot of items to start achieving this vision, and that's one of them that we talked about together, is really taking a look at these undeveloped parcels, or maybe parcels that we think might turn quickly, and making sure that they're consistent with that vision that you approved. But would be happy to go over any of the other items or answer any questions.
Council questions for Abra?
Okay.
Let's get started. Thank you, Abra.
Yeah, I have-
Oh, okay, go ahead.
How many parcels are we looking at changing into high-density housing?
There's been no high-density housing in the vision. So if anything, it was low density that we talked about. So we would basically prepare a map for your review. I mean, I haven't scoped this out with Gabe, but the way I would attack it is really, let's take a look. I mean, I kind of know the parcels like the back of my hand, at least the empty ones, and so do staff. So we would make a parcel map of those ones that would be included in the rezoning updates, and if it were, along Saginaw Boulevard, then it would be consistent with the Saginaw Boulevard corridor. If it were, off of one of those community mixed-use parcels, then that would be the proposed zoning for that area. So it will come to you for review in a kind of methodical fashion, where you get to see the parcels that are up for proposal, and then what the associated zoning category would be, the permitted uses, and the space limitations.
I know that the citizens, and I've mentioned this several times before, they said they want, safe travel, they want family-fun venues, they want sit-down restaurants, they want green space,
Absolutely.
They want a safe place to live, but it seems like everything we do has to bring in more people. So what percentage of this are we looking at for bringing in more homes and more people compared to bringing in what the citizens have repeatedly asked for?
You guys approved a vision that is consistent with what the community has asked for. And when we bring those proposed amendments forward to you, we'd be happy to outline residential uses specifically for each parcel. And I can run a calculation on percentage of land area, and I can also run a calculation on number of parcels that we bring forward that would include residential uses. However, it's not going to be apples to apples, because if you're asking, how many of 16 parcels would develop with two-story multifamily, we won't know that answer, because it would be just one of the permitted uses. But we can highlight which ones would allow that for your consideration. And if it's too many, if it's too much, then you guys as a city council, and actually Planning and Zoning Commission would be seeing those as well, would say, this is too many, this is too much, let's take it down. With the lens of the comprehensive plan. State law requires that cities who have a comprehensive plan zone in conformance with it. So you would want to be making sure that the zoning amendments are consistent with the comprehensive plan.
I thought the comprehensive plan was a guide. Now
It
it
is-
sounds like
It's a plan that has parcel-based guidance in terms of what the future land use designation is and where proposed roadways should go. So part of zoning is really taking a look at that future land use component and making sure that we are putting forth zoning categories that are consistent in terms of what uses are allowed and the intensity of those uses in terms of like height and any other measures that you guys might see fit. So our job as your technical consultant will be to propose those to you and explain why they're consistent with what the plan says.
And I would like to point out, correct me if I'm wrong, some of these, if some of these vacant parcels are rezoned, we might find that they are even advantageous and a more preferable zoning than what exists at this time. And that's subjective.
It's highly likely that you will see the uses that the community is asking for on these undeveloped pieces, because it's essentially a deregulation of things that you want, things that are consistent with what people have asked for. And it's a regulation of things that you don't want. So if we don't want tire recapping, as a random example, on Saginaw Boulevard, then let's make sure that that's not allowed on Saginaw Boulevard, and let's put it in an industrial area. But if we do want a whiskey cake restaurant with outdoor seating, or whatever the venue is, then let's make sure that we back into those to make sure that they're allowed in those areas.
Other questions for Abra? Our frequent flyer and
Thank
friend. Thanks for coming back out.
Thank you.
All right, council, I entertain a motion on item number 13.
Mayor, I make a motion that we approve the action regarding the master service agreement with Loveland Land Solutions.
Okay.
I'll second.
Mr. Beasley, second. All those in favor, raise your right hand. Those opposed? Thank you, guys. Look forward to working with you, Abra. Item number 14, consider action regarding appointment to the library board. For that, Janice England, City Secretary.
Yes, Mayor. Earlier this year, one of the members of the library board resigned from her position on the library board. And also, within a few weeks' time, we had an applicant, Tricia Barbarick, submitted an application to serve on the library board. She's a longtime library user, active in library programs, and has also been to several library board meetings. Her application is in your packets. And at the February 8th meeting, the library board considered her application and discussed her and voted unanimously to recommend to the council to appoint her in the vacant position. Library Director Ritchie is here tonight, and if you have any questions regarding her, she would be glad to help us out on that. We went ahead with this. Normally we do reappointments and appointments in June. The library board's set up a little bit different. They have 3-year terms that run concurrent with the mayor's term of office. So those won't come up again for a couple of years. So that's why we went ahead with this particular appointment, so they could get the board back to full members. So that's what we would like to present.
Thank you, Janice. Any questions? Okay.
I understand this is the only applicant for this board position?
Yes.
What do we do to advertise that we have these positions available so we could see if there's other interested parties?
We have information on our website. We put out periodically invitations or flyers, whatever announcements that you can apply at any time. We take applications year-round.
Mm-hmm.
I don't get very many. It's not something that's real glamorous or people are looking for, but sometimes when we have someone that is interested that the library board or whatever board knows of, that's familiar with and comfortable with, would be a good fit, then they go ahead and consider and make a recommendation.
Okay.
Right now, this is the only thing that we've had, or the only person since last summer when we did reappointments that indicated any interest in the library board.
Okay, thank you.
All right, any other questions?
Yeah, is there any pressing need why we wouldn't just wait and appoint this when we, all the rest of them came up and give people?
It's 2 years away.
In June.
Isn't it 2 years away?
Just asked tonight.
It's 2 years away if it's with the mayor's.
But I'm saying we're fixing the appointments in
Oh, I see what you're saying. I see what you're saying.
A lot of
Okay.
people will then apply.
The one reason that we brought it, and Ellen could address this as well, I think they've had some, I don't know, illness or whatever, people working in difference, and had some problems with the quorum a few times, and they felt that getting this other one would give them a little upper hand on making sure they could meet as needed. But she could address that better.
I don't want to hold the library board up. The library board has already approved this person, so I don't really want to hold them up. I mean, let's get it going. It's not a. We've had one person apply. The library board approved it. They considered it, approved it. So I think we should take action on their recommendation. So any other questions,
You're good
comments?
with this, Ellen? Okay. We didn't say anything, so I just want to make sure you're good with it. Okay.
Yeah, she has attended one or two meetings, and at the last one, there was a general discussion, and I think it was Rick Russell, the chairman, who said, let's go ahead and vote to recommend this so that you guys would have that in front of you, that everybody was in favor of it. Yeah.
Okay. Thank you all. Great. I'll entertain a motion, folks.
Mayor, I make a motion that we approve the person that wants to be on the library board.
Okay.
Yes.
Cindy, second. All those in favor, raise your right hand. Opposed? Excellent. Thank you, guys. Thank you, Alan. Tell the library board thank you. Executive session is thankfully not required.
Yes.
So I will entertain a motion.
I make a motion, we adjourn.
And a second. All those in favor? At 8:26, we're out of here. Thank you all.